Is it live? Hello,
Probably.
everyone. We are live.
Yes.
Welcome to our live stream. And I think we are now on Facebook, YouTube, and Instagram. Thank you all for joining us. Today we have Ming Vincenti, who is a public affairs specialist at the VA Maryland Healthcare System, but also who works in outreach. Before we begin, I would like to remind you all to hit that like and heart button and also to subscribe for so this way you know whenever we are posting a video that has good information. Today we're going to talk about enrolling in VA healthcare. Thank you, Ming, for joining us today.
Thank you for having me. This is, I think, a great opportunity to give an update to some of the people who are watching and to let them know how they can help us in our aim to get all veterans who are eligible for healthcare enrolled.
Well, that is a great thing to be talking about. But let's talk about who who is eligible for VA healthcare and how has the PACT Act changed that?
Well, the PACT Act, which was enacted in August of 2022, was the largest expansion of VA healthcare, possibly in the history of VA. And it's tied to toxic exposures that you were exposed to during service, whether home or abroad. So it's not just for combat veterans. There are veterans who are receiving benefits through the PACT Act who never left the country but were exposed to different toxins during service. And what it does is it just increases your eligibility for VA healthcare and also other VA benefits like compensation and benefits.
So how does one know that they are eligible for VA healthcare, and has the PACT Act changed the eligibility?
It hasn't changed it has changed the eligibility. Veterans who were previously not eligible could now be eligible under the PACT Act. And the best way to find out is to go ahead and just apply for VA healthcare. There are several ways that you can do it, whatever works best for you. If you're web savvy, you don't mind going online, that's one of the easiest ways. Just go to va.gov/health-care. And I'll type that in the chat box and click on apply online. So you can go and put all that information in online and submit your application that way. If you're not someone who likes to go online and do things that way, you can call a toll-free number, 877-222-8387. Again, it's 877-222-8387. And that number is open from 8 a.m. to 8 p.m. So you don't have to worry about if you're working during the day about taking a break from work. You can do it when you get home up until 8 p.m. And there we have people who will talk you through the enrollment process or the application process to help get you enrolled. If you'd rather do something face-to-face, you can come into our medical centers at Baltimore and at Perry Point. To go to our enrollment center and admissions office at Perry Point, and just speak with someone face to face to apply. And then also the old-fashioned way of getting a form that you can fill out and then mail it in. But really the two most common ways are to either go online or to give us a call.
That's wonderful. So what do veterans need to have when they do make that call or when they do come in? Are there special documents that they need to have?
There are. Basically, it would be your DD-214 and also your financial records from the previous year. But if you do go to va.gov/health-care, it will list everything you need to have before you get prepared so that you can sort of like doing your taxes, so that you can sit down and get it done.
Well, that's great that VA is making it so easier to apply for VA healthcare. I think many veterans don't know that they have to actually apply for VA healthcare once it's not part of the benefits, that they actually have to do a separate application.
It would be wonderful as soon as you became a veteran, as soon as you left the military, if you were automatically enrolled, but that is definitely not the case. And so that's why we try to make sure that people know that, the veterans know that. And we have veterans who will apply for VA healthcare as soon as they leave the military. And then we hear from ones who, some of the events that we go out in the community, they'll bring their DD-214 from the 60s or 70s that they carry around with them. And we always encourage you, however, to do it sooner rather than later. And that actually is one of the myths that we try to bust. With regard to healthcare is for our younger veterans, those are healthy. Maybe they already have their own health insurance. They have a doctor in the community. They say, "I don't need VA healthcare yet. I'll wait." Well, that's not really we don't advise that you wait, because if you go ahead and you sign up for VA healthcare as soon as you can, even if you're healthy, you can still keep your own insurance. You can still see a community provider. We do ask that you see a VA primary care provider every 2 years, once every 2 years, and that keeps you eligible for different VA healthcare benefits. If you ever go to an emergency department, if you need to use an urgent care facility that is part of our network, it's a lot of good benefits, and it also helps. You don't want to wait until that time when you do get sick. I personally had instances where we get a call from a granddaughter of a veteran who has been perfectly fine until they reach their 90s. And now all of a sudden they're 93, they're sick, and they want to get services for them. And that's not really the best time to do it. Another instance is veteran had a stroke. And so as a spouse of that veteran, you're dealing with so many other things that are going on that are connected to that. If the veteran was already connected to VA healthcare, it just makes things go, a lot easier. So we always recommend go ahead, apply as soon as you become a veteran, and get into the system, get to know us, let us get to know you, and we can, like I said, even if you don't need us for as your only healthcare provider at that time, we can be a great safety net, is the term that we use in the future.
We have a question on YouTube. How can vets enrolled in VA healthcare help share the information?
That's a great question. Thank you, Ms. Griffin, for asking. We have a campaign called Tell a Vet, TELLAVET, Tell a Vet. And it was actually a campaign that was done many, many years ago. But as we hinted to with the PACT Act and different eligibility factors, things have changed a lot. So we do ask the veterans who are enrolled with us, who are using VA healthcare, to help us spread the word to veterans who may not be connected with us in any other way. And there are many ways to connect with us nowadays, through social media, through Facebook, Instagram, YouTube, X, signing up to receive our email updates. But there are still veterans out there who could be eligible for healthcare, and they don't realize it. They don't know it. And we may not be able to reach them through the different methods that we use, but our veterans out there who do know about us, we would love for them to help us by telling the vet, "Hey, did you hear about the PACT Act? You might be eligible now." It's really easy to go. It's not a huge hassle to sign up. Here's the phone number. Here's the website you can go to. And, if it's a veteran who's maybe not savvy online and you are, then certainly you could sit down with them and help them. And we definitely appreciate that. And help your fellow veterans out there who otherwise could just have no idea of the different benefits that they're eligible for.
Well, some of the reason that they have no idea is because of the myths that are out there. For instance, we've heard veterans say, "I didn't serve in combat. I wasn't injured during military service."
Right.
Can you please talk about the facts around that?
Sure. And some people consider being called a veteran as what we would call a combat veteran. And if you served in the United States military, you are a veteran. If you're female, you are a veteran. That's another thing, is that female women who serve don't always see themselves as veterans, and that's not the case. Of course, those numbers are going up from like 7 to 10% female women veterans or in the service, and then veterans. And that number is, of course, steadily rising. And VA across the nation, not just the VA Maryland healthcare system, VA is responding to that. We have a special women's health program within nationally VA, and then also the VA Maryland healthcare system, that's geared towards the special needs of women veterans. And we actually do a biannual public forum with our women veterans to kind of get their feedback and to get input from them. Let us know what we're doing good, what we need to improve on, and we are really aiming to give them, our women veterans, the specialized care and focus that they need.
And the other myth that we sort of hear is, I'll leave my spot open so that another veteran who needs it more than I do can receive care. Can you talk about that myth?
And that is one that I've personally seen. I've heard people say that. We do events out in the community. Each event, there's at least one person who comes up and, is very proud. Oh, I'm healthy, and I'll let that veteran who has maybe lost a leg or is sick take my spot. And that is actually good intentions, but I love to explain to people how that's not really the case. Because the more veterans who are using VA healthcare, the more funding that we get that can be put into providing care for veterans. So definitely the notion, while it's very good intentions of leaving the spot open, you don't need to do that.
And talk again about those veterans who feel like they already have health care and a provider in the community, and there's no reason to apply. And we hear this from a lot of younger people who may not quite understand how their minor service-connected injuries can really require specialized care as they age. So can you talk about getting in early rather than later?
Right. Well, like I said, I equate it to me going into a drugstore to get cough syrup when I'm sick versus when I'm not sick and I just want to stock my cabinet. So if you're feeling healthy, you're feeling strong, you don't have any kind of issues with just being sick, maybe having vision issues, hearing issues, things like that, we do recommend, it's always a good idea to just go ahead and get the process rolling when you are feeling well. Because if you're sick, or once you get to that to older age, like I said, you could have a stroke. It just kind of complicates things. And why not just go ahead and it's not like once you're enrolled, it's not like, oh, you have a certain period of time and then your plan is expired. Once you're enrolled, you're enrolled. And you have that kind of peace of mind that it's done, it's taken care of. And then, like I said as well, it helps you get to know VA, learn how to kind of navigate, learn about the different things. I mean, VA healthcare is not just going in for your primary care appointment. There are so many different programs and services that are available to you through VA healthcare. And even if you are healthy and well, some of them could appeal to you for whatever reason. So that's why we recommend anyone who's listening now and is not enrolled, definitely to go ahead and go through that process, get started on that, but then also to share it with the veterans who you know.
So what happens after people enroll? Like, what happens when, what happens once they send their paperwork in? What happens after that? Does it
They'll be notified with a letter in the mail, and it is relatively fast, especially if you do it online. Within some guidance that we send out, it says if you haven't heard back within a week, to go ahead and give a call and give a status. And you can always call that number, the 877-222-8387, to check on things, to see where the process is. I see we have a question here. The vet has a doc in the community. Can they work with VA? Absolutely. Dual managed care. Definitely our care providers, physicians and healthcare providers will talk to and work with your private physicians in the community to make sure that everything is consistent with your care, and that's kind of an ideal situation.
So did I not ask you something that you think is important for veterans to know about enrolling in VA healthcare or sharing the information with fellow vets who may not be enrolled?
Well, I gave out the web address to enroll. VA.
So what is that web address? Because I'll put it in the.
Actually, I'll go ahead. Well, let me see. I think I can do that myself. I'll go ahead and type it in here. And that is a national website. But I also recommend going to our own website for the VA Maryland healthcare system and clicking through that to see about some of the things that are specific to, see, there we go. And then let me do maryland.va.gov, which is our website, which will talk to you about the different locations that we have throughout Maryland. We have medical centers in Baltimore, at Perry Point in Cecil County, and at Loch Raven. And then we have clinics let me go this way around the map. We've got Fort Meade, Glen Burnie, Loch Raven, Perry Point, Eastern Baltimore County, like in the Rosedale area. And then on the Eastern Shore, we have Pocomoke City and Cambridge. If you're in not necessarily close to one of our medical centers, you can get your primary care probably closer to home. And what else will you find on our website? We've got a resource guide that will have some of the information that we talked about today in it. And so you can go to our homepage at maryland.va.gov and scroll down to see the resource guide. You can see some of our latest news stories. Just click around on that page to get to know us a little bit better. And certainly you'll probably find information that will, if you're a Maryland veteran, that will pertain to you and interest you.
So what is that phone number again? 8?
Sure. 7? Oh, yes. Oops, and I see my one comment did not go in, so I'm going to try that again. The phone number is 877-222-8387.
All right, I just put that in the comments.
Okay. Perfect.
Okay, and is there anything else that you want veterans to know about applying for VA healthcare and why it's to their benefit to actually get that process started sooner or later?
If it just, that's kind of sums up what we just talked about, is that every veteran should apply, and that there are multiple ways that you can do it, and go ahead and don't put it off. You will likely be grateful in the future if you just go ahead and do it now and get things taken care of.
All right. Well, thank you so much, Ming, for helping us explain to veterans the importance of applying for VA healthcare. And we gave folks some resources to how they can sign on for VA healthcare, and also go to our page, our website, to check around and see what other services are offered.
One more thing, if I can interrupt you, Rosalia, I'm sorry. If you do go to our homepage, one more important thing is to sign up for our e-news announcements, and that will give you a subscription to our e-news services and an email that when we have something to go out, it'll go land right in your email box. Like yes, on social media is also good, but this way you'll definitely make sure that you get the announcements that we send out.
Well, that's good to know. So everyone who's listening, please sign up for the email newsletter that you get in your email in your inbox on our webpage. And veterans, if you have not signed up for VA healthcare yet, what are you waiting for? Thank you, Ming, for explaining all this to us. And thank you to all the listeners and viewers who've come. And we will talk to you soon.
Sounds good. Thanks, Rosalia.